we got his blood pressure on scene. Got this blood pressure. We got 140/90 blood pressure. We're gonna check a heart rate. We're gonna listen to it. Listen to it, gotta watch. It's for a good minute. And okay, we got 160, strong, still irregular. We're gonna put him on the pulse ox. Put on his finger. Reading at 96% on the 15 liters, that's good. Respers, he's still 26, it's less labored with the oxygen on. And we check a VGL, this is 100. Then we're gonna listen to lung sounds lastly. Listen top, top, bottom, bottom. And while we listen to lung sounds, we do hear rels. So with all the information we have, we either say if we advise him to go, which in my opinion, I advise the patient to go. So I'm gonna ask the patient, sir, I think it's a good idea for you to go to the hospital, get checked out with your recent history and the vitals we see right now. We think you should be able to go and get checked out. Okay, he agrees. So we get him on the gurney, load him into the ambulance, and we head to the hospital. We do not need an ALS due to us being closer to the hospital. I am going code 3 to the hospital due to hearing the rails, the red sputum, and his history of cardiac history. So since he does have rails, I am going to put him on a CPAP due to him having rails and the red sputum coming out. So we're going to tell him, sir, we ever had a CPAP before since you had a CHF. For this thing, we're going to say he has not had a CPAP on him yet. So we're going to explain to him, sir, it's a mask that goes over your mouth. He's going to feel like you can't breathe, but trust me, it's going to help you be able to breathe better. So we're going to explain to him it's just a big mask go around your face. You're going to feel just oxygen blowing in your face, but it's going to help you feel better. He agrees with it. He has no times 4, so we can't put the CPAP on him. So we put the CPAP on the patient while we're in the ambulance to help him. And while doing all that, we are transporting. We're going to keep reassessing every 5 to 10 minutes to the hospital. If we have time, we are going to do a head to toe right away, just a quick one since it's medical, make sure there's nothing we don't see in the stomach, arms, legs, head, nose, no swellingness in that. We don't see nothing major besides the swelling in the legs. Okay, so now we got all that, we put him on CPAP, gave him aspirin. Now I'm just going to give a report to the hospital right away to clarify it. So we give a report, call the hospital, give them our ambulance number, our where we work at, and then the hospital answers, go ahead, and then we're going to give the information that we got. So we say we had a 70-year-old male, chief complaint, shortness of breath and chest pain. We say, he said it's happened for about 3 hours now, just been worsening. We did hear some rails, and he did say that he had red sputum while coughing, so we put him on CPAP right now. Gave us 324 milligrams of aspirin prior to arrival. Does have a history of CHF, AMI 2 years ago. Coming in code 3, we'll be there approximately. Oh, here are the vital signs following: blood pressure 140/90, heart rate 160, strong, irregular, 96% on the CPAP. Respiratory at 26, less labored still. No more rails after checking, reassessing. A VGL of 100, the lung sounds are clear without the rails after the CPAP. We'll be there approximately 5 to 10 minutes. Got any questions? See you there. Okay, so that we do that and then get the rate report. And now we just keep reassessing the patient, make sure he doesn't decrease, make sure nothing changes during transport. Just keep reassessing him, vital signs, see if anything changes at the time. Keep asking the CPAP helps. Make sure he's still A&O. Just to make sure he doesn't decrease during transport. And just keep reassessing him.